big change in COVID vaccination plans, schedules, testing for LSU Health, right? First of all, what is it? And then you can tell us why.
Yeah, it's actually a small change for us and for the community. We know that there's a lot of vaccine and testing available in the community. And so this week is just a pause for us in terms of community testing and vaccinations at our site on Linwood Avenue, because we are ramping up very quickly to meet the K through 12 testing goals with the state, which our region extends all the way down to Lake Charles and all the way east to the Mississippi border. So we've got a lot of area to cover with our staff.
So it's basically just a shifting and adjustment of manpower, and get into more about what you're going to do with the kids then.
Yeah, that's a big part of it. You know, the National Guard is still all deployed down south, so we don't have National Guard support as we haven't over the past few weeks. And, of course, the public health nurses and teams have been working in the shelters, and some of our nurses have been helping out in the shelters as well. And so we're having to be very strategic and thoughtful about, you know, what we're doing and how we're taking it on. So this week will be a pause. It helps us get ready for anticipated boosters coming in the next few weeks.
As far as boosters are concerned, all three, Moderna, Pfizer, J&J, what will be available?
Right now, only Pfizer and Moderna are available, but the FDA is looking at all the data from all three manufacturers to make, you know, the best recommendations.
What would be the hesitation on something like J&J if it's like the other two, Pfizer and Moderna, where it's really just a third dose of the same thing? Why would there be any kind of holdup with J&J being a second dose of the same thing?
Well, part of it is that we know the J&J vaccine is not as effective against the Delta variant, and so there are other strategies that are being looked at, whether to vaccinate, boost people who've gotten J&J with either a Pfizer or Moderna vaccine. That may be a reasonable strategy, but again, FDA and CDC are first looking at all that data very meticulously to make sure they're making, you know, good decisions on vaccine deployment.
You get into any arguments with anybody about the vaccine, and when you do, what is the number one objection to being vaccinated that you hear from the most folks?
I think there are two things. Still, there's the hesitancy about not having, quote, long-term data. And as I said all along, we'll have long-term data when we reach long-term. And for different people, that's 6 months is enough, a year is enough. We're well past a year now in terms of understanding safety and efficacy of the vaccines. And so that's number one. The second is, of course, you know, the overreach concerns and personal liberty kind of infringement argument. And my strong position is, you know, like Tom Bodett with the Motel 6, we'll leave the light on, and folks, when they're ready, will come get vaccinated. It is safe and effective, and I stand by that.
If somebody has not been vaccinated yet, we're talking about Moderna and Pfizer now for the sake of this question, how does the booster play into that? Do they just go first shot, couple of weeks wait, second shot, couple of weeks wait, then the third shot, how soon after that? Or does the booster even play into somebody that hasn't been vaccinated yet? Yeah,
it's not a concern or doesn't play in for those who haven't been vaccinated. We still need more people to complete their primary series with any of the vaccines available. And boosters, you know, again, the FDA and CDC are looking at that data, but the anticipation and the tea leaves are telling us, at least at this point, you know, the data we have available says that boosters are not necessary at less than 8 months out from the second dose for Pfizer and Moderna, or after the first dose for J&J.
So LSU Health temporarily suspending testing and vaccinations. What's the website they can go to? Folks can find out more details, get all the info. What is that again, please?
LSUHS.edu.
And maybe I missed it earlier on. Do you have a date in mind? Does the school have a date in mind to resume both vaccinations and testing?
We anticipate it'll be next week. So this is just a 1 week pause is our current plan, and that's what we're doing our best to stick to that. And we're preparing again for boosters, because that's going to be another, you know, thousands of folks coming out to get boosters. And we want to make sure that we have facilities in place and all the things we need to be ready to make that efficient and safe for everyone.